We're now less than a month away from a significant change to the 988 Suicide Hotline, specifically the removal of its LGBTQ+ call option. All of this follows recent decisions in the Health and Human Services budget, which is set to cut funding for LGBTQ+ support services. Tonight, we spoke with local LGBTQ+ advocates about the impact this could have on the community.
The administration is so loud about how they feel, and we knew a lot of this stuff was coming.
Phyllis Galisath lost her son Liam to suicide in 2018. He was transgender and gone too soon at the young age of 18.
LGBTQ people, especially trans people, have a lot of unique challenges that they face.
In Liam's honor, Galisath started the Liam Foundation to provide resources and programming for LGBTQ+ youth in our community, specifically transgender youth. So when she saw that LGBTQ+ resources are being stripped from the Suicide Hotline, it definitely hit close to home.
And they have higher risks and rates of suicide, self-harm, addiction, all of these issues that come into play because society isn't made for them, especially trans people that are transitioning gender.
The Suicide Hotline was created in 2005, with the official 988 hotline starting in 2022. Across the last 3 years, trained professionals have answered more than 13 million calls and texts. 1.3 million of those were LGBTQ+ youth and young adults.
And knowing that someone really cares for you holistically as a person can be the difference between life and death. And having that safe place ripped away from so many people, it's really hard to put to words how scary that is.
A senior Trump administration official said the money for services for LGBTQ young people has not been cut, but rather reallocated to general 988 services. For advocate Emily Grobe, saying the LGBTQ community can receive the same services generally is a slap in the face.
I could see why it might seem like a win to aggregate everyone under one kind of umbrella and be like, everybody gets the same thing, you know. But I mean, as it stands, 988 has other subcategories. And
those subcategories, like veteran-specific and Spanish options, are here to stay.
Maybe you're on a journey, maybe you know what your identity is, maybe you don't, maybe you're really deeply in the closet, maybe you're fearing for your safety. There's so many factors that complicate something like that, where a generalist approach to suicide prevention might not be enough.
Well, if you're a Spanish-speaking person, you're going to need a Spanish-speaking person on the other end to connect and to be able to make that rapport. This community faces a lot of unique challenges that people who haven't been trained or know, they may not understand.
Galisath says this is just the beginning.
It's just the erasure of the community, the attempt to remove everything from websites, taking LGBT off. We can't use the word gay. These things, it's very similar to things that we've seen in history.
Now, according to a statement from the U.S. Department of Health and Human Services, those changes are set to go into effect on July 17th.